Thank you for everyone for joining our webinar on normal pathology filing and SMS patients. If you want to, that is, depending on who's paying for the SMSs. Sanjeev and I will take this webinar and talk through everything. As I mentioned at the beginning of the webinar, before some of you had registered, it's been quite a big attendance today, so we just waited a little bit longer for the final people to join. We will also we're also recording this, and we will share the recording afterwards and a list of questions and answers as well. We've also got something new that we're doing. We've done a special page which we'll share with you after the event for people that want to make a purchase, where you will be entitled, where you'll be able to get a slightly discounted rate if you wanted to buy it, if you want to proceed and purchase it online, and we can talk about details on that afterwards. But let's go through the important stuff first, and that is what is MyBotGP, and why it's so successful at the moment and being taken acquired by so many practices and PCNs. I believe we've signed 3 PCNs in the last week and a half, and multiple individual practices, and we've got bundles more tracking through at the moment. So as you may know, we have a number of products live for EMIS at the moment. Normal pathology filing, document filing, and repeat prescriptions has recently gone live. For SystmOne, we have normal pathology filing, so this webinar will cover that, and we hopefully will be following in the next few months to even out our SystmOne products with the equivalent paperwork filing and repeat prescriptions automation. So let's get to it. What is MyBotGP and how does it work? Sorry, people are still joining. MyBotGP are a bespoke product set that's been built specifically for primary care. What does that mean? Well, one of the challenges in primary care is everybody does the same thing in a slightly different way. So when you're looking at pathology filing, you potentially you have, or even normal pathology filing, you have 6,500 practices and 6,500 different variations of how you would qualify what's normal or abnormal and approaches to follow that. And that's using the assumption that at one practice that's one decision, but we all know at practice level there would be multiple decisions across different partners as to how to filter on normal and abnormal. You then supersede that with the fact that you're all supplied with pathology ranges from different labs. Different labs can use different ranges, different keywords, or different omissions of keywords. Those labs and ranges can change on a fairly regular basis. And also you need to be able to have a tool that if you wake up at 2 o'clock in the morning and decide that you want to change some ranges, or you're an approach to something, that you can quickly log in and do that, and you don't need to wait for someone else to change that for you. So we built MyBotGP on the basis that it can tick all of those boxes. It's a product, it's a downloadable product that has fixed logic that you can use. You have full access to it. It's a 10-minute download, 20 minutes to connect it with EMIS or SystmOne, and then it can be live straight away. But then over a period of days, it picks up more and more pathology tests, and it asks you what to do with them, and you tell it what to do with them, and it will file them and action them. So it's up and running pretty much straight away. You can include the pathology test that you want to include. You can filter on the logic to decide upon normals or abnormals that you want, and you can change that whenever you want as well, which is super important. Where it starts to get really interesting is if you're acquiring this as a PCN, you might have a couple of different labs, or you might be using the same lab, but there could be 3 or 5 or 7 practices within that PCN, or more or less. You can all have your own copy. And you can all define your own rules, and you can change those rules as regularly as you want, and you will all be up and running within a couple of days. MyBotGP will live on a computer. There's a lot of conversations around what type of computer, where that computer should live, but in principle it can live anywhere. It can live in a hosted environment, which means we have a hosted solution, or it can live on a spare computer. It's up to you. And again, there are conversations we can have about that further down the line if you want to. So I'll just quickly skim through this stuff. It's just more sort of due diligence. You know, our tooling, we were part of a government-funded and NHS-funded Launchpad program that we completed last year for innovation in healthcare. It's nice to share that. All of our automations are obviously clinically driven. We've got masses of experience working with practices, PCNs, federations, and ICBs, which is why we built MyBotGP. We let everyone make their own decisions how they want to use their MyBotGP at practice level. We see it as a practice helper. We are working with some PCNs that have centralized all of their pathology filing or coding, and then it can live there. So if you have got agreed standardized approach across a PCN, you can have one copy and it will follow it through there. Again, important stuff. We have a DC. This tool has a DCB 0129 as a clinical risk certification tool, which means we have a clinical safety officer who's a qualified clinician that's done additional training and has signed this tool off as certificated. Obviously, DPIAs and DTACs, the normal stuff. We can share that. MyBotGP, an ICB requirement is multi-factor login. Which in English is basically when you log in, it will send you an email to validate that it's the right person, and that's a new ICB requirement as of I think 4 or 5 months ago. And yeah, so let's get to the interesting stuff. Obviously, we're experts at working with EMIS and SystmOne, you know, Accurix for message sending. Although within TPP, we don't need to use Accurix for MyBotGP pathology to send text messages. That's the challenge. I had a lovely call with the very senior head of pathology for a region about 3 weeks ago, who told me that figure is now billions. That's from last year. That's now up into the billions. So that's the volume of work that you're doing. And in principle, when you if you can remove the normals, again, we'll cover off what a normal is in the world of MyBotGP. You can free clinical time. You can get to the abnormals quicker, and it's around 70% of them. I'll share a spreadsheet. You will have been sent a copy of it already, but I'll put it on here so we can talk through it with examples showing that one of our clients or a number of clients have now used MyBotGP to filter on well over 100 pathology tests, and one of them is now up to 131 pathology tests. Now, that's not saying that you will agree with all of the rules that they've applied to those 131 pathology tests, but it will show you how different people are interpreting what they can do with MyBotGP. So what is it? So think of it as a helper. This helper, let me put that over there. This helper, you've given it permission to look at all of your pathology tests. You've told it which pathology tests it's allowed to action, and then you've given it the logic rules that it's allowed to action. In order to filter on normal or abnormal. So all of so you can configure the pathology checks based on any combination of the following decision points. And actually, let me come back to something. What I'm going to do is we're going to run through this. We're going to show you a quick demo, and then if you've got questions, please pop them in the chat. We like people to ask questions. It's good to go through anything, any queries that you have. And both Sanjeev, who runs our technical teams, and I will answer the questions to the best of our ability. And anything that we're not able to answer, we'll come back to you after the webinar. So coming back to what the product does. So if you think about it, when you're reviewing pathology tests, you're following a logic, and that logic tree determines on the type of test and why you're looking at that test. So the rules that MyBotGP is underpinned by are you'll be validating against minimum and maximum ranges, checking previous test results for percentage increases or decreases, and those percentage increase or decreases, the actual figure is determined by you, and which pathology test you want to use that anchor point, that logic tree for, is determined by you, as with all of these logic points. Keyword checks or absence of keyword checks on the path report or in the patient record. There's lots of reports that come through where they use keywords, or some don't have ranges, so you can only use keywords, and I can show you some examples of those as well. Gender and age. So essentially, you can configure MyBotGP to open up all of the pathology tests, look at each one, and then if you wanted to add all 5 of these for every pathology test, you could. I mean, you wouldn't, but you could. Actually, 5 is to here. But you tell it, okay, for this pathology test, I want you to look at ranges, or for that pathology test, I agree with the lab, and if the lab says it's normal and I agree with those ranges, please file it. Or for that pathology test, I don't agree and I want to adjust the range and I want to add an additional keyword check, or I want to split that off in terms of age or gender, or look for a percentage increase or decrease. What's really important, and something you might not be aware of, is something I talked about at the beginning. You can change the configuration anytime yourself, simply logging in with a username and password. I cannot emphasize how important that is. You do not work in a static environment, so having a tool which can be changed, that you can change at practice level whenever you like, is paramount. You have a username, a log. I mean, obviously there are protocols in place as to who can make the changes, but in principle, this tool has a username and a password. And if anything changes, or you want to change any of the logic that you're using to filter on any of the pathology tests, you will log in with a username and password. It's all audited and tracked, and you can change it and save it. Why that's important is you are going to want to change it, and if you have to wait to make changes for someone else to do them for you, that could take several weeks or months even, it means you can't use the tool, so it's a waste of money. And this is why we built MyBotGP. It's in your control to bespoke as you like, and you can change it whenever you like. No one, you're not beheld to anybody else, and that's all covered under one fee. This is the next generation of automation products. You can supersede lab ranges if you wish. Again, final decisions on what you do is at practice level. Nothing is removed from EMIS or SystmOne. How you archive or what you do with the pathology test is still up to you. And different practices we've seen have got different approaches. What MyBotGP will do is read all of the path tests, make a decision based on everything that you've asked it to do, and tag it and mark it. And for the ones that you want it to file and send a text message, it will, and the ones that you won't, it won't, and so on and so forth. There is a really detailed audit log that's emailed to you and whoever you want at the practice at the end of each day, showing exactly what it's done. And there's a further audit log inside MyBotGP as well, so you can push that down to practice level. Continually learns. What does that mean? So that's really interesting. What we've done with MyBotGP for pathology filing is when you plug it in for the first time, it will read all of your pathology tests. Okay, and I'll come back to this after. Let's take this as an example. This could be all of the, actually we'll come back to that in a moment. So it will read all of your pathology tests and it will take a snapshot recording of your lab, how they've spelt all of the names, all of the ranges, and all of the checks that it has, and it will save them into the memory. Doesn't do anything with them, doesn't make any decisions on them. After a couple of days, it will have seen several hundred pathology tests, maybe less, maybe more, and it saves them all into the memory. Then what happens is you then open up each one and you simply say, do I agree with it? It's all in red. If I agree with it, click yes, and MyBotGP will agree with it. Double click the next one to open it up. Do I agree with that? No. What I want to do with that one is I want it to look at the previous test result for a percentage increase or decrease. Save, it will do that. Next one, yes, I want to split that off in terms of age, and so on and so forth. So what happens is every day, excuse me, I'm going to have a drink. It will produce you a report of new pathology tests it's seen, and it will ask if you want to include them. And if you want to include them, you just double click, open it up and say, yeah, I'm happy to include that on that basis, or no, I don't want to use that one. That's not for MyBotGP to look at. So over a short period of time, you can start to get it to do more and more and more for you and start to save time. We're really proud to share, as you saw on the literature, and I said at the beginning of the call, that when we first launched this product, we had clients live with 30 or 40 pathology tests. Then we hit 70, then some clients hit 70, 75. Now a large tranche of well over 100, and we've got one at 131. Some are including NHS health checks. as well, the generic ones, not the ones that are asked for specifically as well. So we think the numbers will get higher. Of course, it will saturate at some point, and of course, you will all have different opinions as to what's in and what's out. This is just we're just here to show you the sort of capability. So this is the user interface, and I'll show the spreadsheet and talk through the spreadsheet with you in a moment. That's got examples of what some of your colleagues are doing across the NHS. So let's say MyBotGP read that from your path lab. Okay, and that's what it's seen. So you've double clicked on it and opened it up to see whether you agree with it or don't agree with it, or whether you want to include it in MyBotGP or not include it. So first thing is, if you want to file that for a normal report, excuse me, and you agree with the lab and you agree with the ranges, you just click that box. And then every time it sees a liver function test with these ranges, no need for a keyword check, no need for any checking against the patient history record for a previous test result for a percentage increases or decreases, it will file it for you. If you want it to send a text message, you just tick that box and it will send a text message. If it's EMIS, it's through Accurix. If it's TPP, it's through there. Now, let's say you don't agree with that. Okay, and you want to add additional rules in. And again, I'm just using this path test as an example because it's got a list on here. I'm not saying this is what you would do with it. So you say, so you don't tick that because you don't agree. Now, if you wanted to look for a keyword is absent, keyword is present, keyword in the problem page, you just tick the appropriate button here and write in the keyword. And one of the checks it will do is follow that. It will look for a keyword or omission of a keyword. So for HbA, for HbA1c, for example, does it say diabetes in the problem page? That could be one of the checks in addition to the others. Next, you have your ranges. If you don't agree with any of those ranges, you can just click on it, save a new range. Or and if for one of these tests or all of them, you said, you know what, I want to set a tolerance, or I want to look for a percentage increase or decrease against the previous test result, you just click yes and write in the percentage tolerance increase or decrease that you're comfortable with. So what you're doing very quickly, literally in a matter of minutes per pathology test, you're utilizing these rules. Is it in range or out of range? Do I agree with the ranges? Do I need to check against the previous test result for an increase or decrease? Do I need to look for keywords or absence of keywords? Do I need to split this off in terms of age or gender? And that's how this is represented in here. Very quickly, and then obviously you've got filing with or without comments. So what does that mean in reality? So I prefer to share this with you. I'm going to share two here, and we'll just skim over these really quickly. If any of you've got questions, and please jump in and pop them in the chat, and we'll come back to you afterwards. But here is what you're seeing is a sample. Again, this is just to make this clear, it's an indicative example of what some people are doing and some of your colleagues are using. We're not saying this is what you should do, but this is what some people are doing. And what you can see here is how those rules have been applied to different pathology tests. And you can see just how many pathology tests they believe can be safely picked up and validated against normal or abnormal. You can see if you go this across here, you've got keywords, omissions of keywords, age, gender, ranges, checking previous test results. The example I always like to show, we've got prostate here somewhere, 5 ages and 5 ranges. That's possible. Lipids, you have other clients that want to look at prostate against a previous test result. Even if a test result is normal, go back and they don't like this logic. They want to check against the previous test result and look for a percentage increase or decrease, even if it's normal. You can see, and we have some here where looking for keywords, I'll get down to those, keyword absent, present. You see very quickly, based on those 5 fixed logic points, those 5 bespokeable anchors, for want of a better word, what pathology tests you can look in and you can review. Now, we're not saying all normals are normals, of course. Nothing is removed from EMIS or SystmOne. Everything is still there to be checked. But what I can say, and I'll show you another spreadsheet here of what another client has allowed us to share of what they're doing. It's quite similar. It's a bit smaller. See if I can make that bigger for you. Yeah. We now have clients, and this tool has been running for quite a while now, filing thousands of pathology tests. They're loading more and more onto it because they've become familiar with the logic points and comfortable with monitoring the tool, checking audit logs, and bespoking it as per their requirements. Hopefully, we're happy to share these afterwards for anyone that wants to have a look at them. For our clients, what we're doing as well, obviously we provide training. Well, they've used the same logic here. We run regular webinars at no cost charge, whereby we let practices speak to each other and see how they can pick out new pathology tests, sharing the logic that other people are using. To see how high they can get this particular client, but I mean this is 2 or 3 weeks ago, so 104, so that could well be higher. So coming back to let me just pull up this spreadsheet now here again. But coming back to this, so essentially audit logs are super important for obvious reasons, and this is a very basic snapshot of the audit log in MyBotGP. We could spend a whole webinar just on the audit log. Needless to say, it has to be really comprehensive because you need to be able to go back and check everything at any time. Everything is audited, everything's tracked, all filings by date, by category, and then a granular breakdown down to patient level, so you can go back and spot check everything. There are considerations to be taken at practice level. Again, I don't need to say this to this particular group on this call, although it's just something that does need to be said. It goes without saying, this is not a tool that's plugged in and not looked at. You have to monitor the tool as you would any technology that you're using in primary care. Our side is the DCBO 129, which has proven that we've taken the appropriate action to build it and to deliver it and support it. Your side is obviously plugging it in and not just turning it on and never looking at it, which I don't believe you would do it anyway, but it's just something important to say. Other reasons why people like using this tool, obviously it's saving clinical time, administrative time, getting to see abnormals quicker. We have some clients that like it because it's enforcing standardization, something that's super important for them. And the audit logs, to actually have a fixed audit for the first time, standardized approach to filing a group of pathology tests that can be physically proven at any time. And obviously there's cost savings as well when you take into consideration the salaries of the people and the skill level of the people that are currently performing this test. If you can remove this task, if you can remove that from them, they get to do other work. And it means you can process more work at the same cost. Believe it or not, the stat for an average practice is each clinician in the country at average practice size is spending about 19 days a year filing pathology tests, normal pathology tests. Lots of people will challenge that and say, well, no, I do it in the evening when I'm having a coffee, or I'm doing this or I'm doing that. But people don't have a very good perception of time. We've got used to just doing things every day ourselves and haven't really quantified what time that takes. An example of that I always give, and apologies if you've heard it before, as there are some people we've spoken to before on this call. If it takes 5 minutes to make a coffee and you have 3 coffees a day, that works out at 91 hours a year. It's a lot of time. And if you put that into an 8 or 9 hour working day, that's how many days a year you spend making coffee on average. And it can take much longer than 15 minutes if you get stuck having a chat. So no, just skimming through something for what feels like 15 or 20 minutes here or there is a significant amount of piece of time long term. So I've got a couple of demos we can show you very quickly. I'll skim through those. We have one in EMIS, one for TPP, but essentially it's the same tool for both. It's just configured in a different way. and then we can see how much time we have available left, and for people that have got some questions, feel free to ask them. So this is the same demo that we've used before. It's a nice clean one. What I'll do is this says EMIS, but actually this front end is for TPP and for EMIS. There's a reminder that I've got a webinar. Okay, so what you're seeing here, I'll just get into here. So we just forward to this piece here. Bear with me one moment. Okay, so I'm going to pause it around about now. Here we go. So again, same description as we went through when I showed the presentation. Let's say that came from your lab. So it's plugged in. That's what's come through from your lab. You've double-clicked on it because you want to see whether you can include it as one of the pathology tests that MyBotGP will look after for you. So first decision is, do you agree? If you agree and you're happy to file that for a normal report each time, you click that button and it will always work on that basis. Omitting these two, I'll come back to these two in a moment. If any of these are out of range, it will fail the whole test. So everything could be fine except for that one. That could be at 12.0. It will fail the test. So, and this is where the bespoke, and if so, again, it will fail that. Now, coming back to what we were saying before, if you wanted to set a tolerance because a particular group of tests came through as abnormal or failed on a regular basis, and you were comfortable with setting a tolerance because in your opinion that was safe, you can do that. So you could set a tolerance for any of these. So you don't click that because you don't agree completely with the lab, or you do agree with the lab, but you want to set a tolerance. That's unclicked, and here's where you can make amendments. You can change the ranges. And then obviously, in addition to that, you have the ability to go back and do check a previous test result and look for a percentage increase or decrease. If you just click yes on any of those or all of those, and you write in the percentage increase or decrease that you're comfortable with. What we're showing here for full blood count is how hemoglobin estimations have been split off for males and females and put different ranges. And then just for demo purposes, we've said, yeah, also check against the previous test result for a 10% increase or decrease as a tolerance on there for an issue. No keywords required, no keyword searches, keyword present, absent, or in the problem page. Sandra will touch on this in a moment. There's an additional functionality for vitamin D as well. So let me just come across here. Next example. And we'll show you in action in both applications in a moment as well. So this was the example that I gave before. HbA1c. Just pause it here. Okay, so that's pause. So of course you can still add additional checks. You're not only limited to only a keyword check. You can do ranges, keywords, previous test result, so on and so forth. But just to show you how quickly you can just click a button and put it in. Here's HbA1c. Yes, you want to send a text message. Doesn't have to be through Accurix. Obviously, it can be directly through TPP. But one of the checks you want to do is, does it say diabetes in the problem page? No, it doesn't. Okay. There's your filing and no action. A couple more examples of this. And just see that running slowly in the background. Okay. Let that run on a moment. Okay, so I'll stop that there. Hopefully that's shown you enough for this particular front config page. And then I just want to I'll open up this one actually. Open this up again. Do you start to see how some of your colleagues are making decisions around what to include and give it permission to filter on their behalf? And we will share all of this afterwards. Coming back to something I touched on really quickly earlier on in the call, what you do with the pathology tests after MyBotGP has evaluated them based on the rules you've given it is up to you. Some are archiving straight away, others aren't, distributing to different places. All of that functionality we haven't touched. That's still completely under your control. Look here. We have one client who I don't know if it's actually on this. We can see if it's on it. They included COVID checks. No, it's not on this one, but obviously you have COVID checks, yes, no, or positive, negative. You can look for keywords in that as well. So when you really think about it, different ones start to pop up in different places. So we'll come back to the second demo. So here. The box is probably open already. If I show you this one here. So this is TPP. Actually, this might be the first one. What you're going to see now, actually no, that's the other one. And I'll run this really quickly for EMIS as well. What you're going to see now is MyBotGP, which is living on its own computer. Where that computer lives is up to you. And it's got its own username and password, so there's a full audit trail, and it's logging in. This has all been redacted. Obviously, some of our clients have given us permission to share this, so we've had to redact everything. I've got Sanjeev is telling me lots of questions that come in, so I'll skim this and then we'll stop and then we'll get to the questions. Thanks, Sanjeev. So what you're seeing is it essentially replicating a person. It's logging in and it's pressing the buttons on the screen or behind the screen, and it's looking for the pathology tests that it's been given permission to look at, opening up, reading them, applying the rules that it's been given, i.e. ranges, age, previous test result, and so on and so forth, keywords, and then filtering on normal or abnormal, and it marks them as reviewed or not reviewed, and you'll see the screen just moving around in the background. I'll let this run for a couple of seconds more, then I'll quickly show the EMIS tool, and then we can get to the questions. I think often people are expecting to see fireworks and all sorts of things going off in the background, but in reality, think of it as a person. You've employed that person to do a very specific task, and what you're looking for and what you do when you see it. But this person doesn't make mistakes, and there's a full audit trail of everything that it does. It works 24 hours a day, 7 days a week, and it's a lot quicker than a person. So if I show you this one, 2 secs on EMIS, and then we can open up for the questions. Again, you're seeing the same here. Also, one of our clients kindly let us share this. So it's all been redacted. Same principle. So in reality, what does this mean for you? It means we can send you a link. You can download it. It's up and running. Connect it to EMIS or TPP. Obviously, get to all the paperwork first. Plug it in. It will read everything. Won't do a thing. Don't need any clinical time for the install. Then we book a meeting. You do need some clinical time, about an hour and a half. Share a screen. We'll show you how to open up each path test that it's looked at, apply the logic, press save, show you how to use the audit log. Most clients get up and running with 30 to 40 path tests in the first meeting. About a week later, we book another meeting with you for about an hour again. By then, you've got a bit more comfortable with the tool, got your head around it. a bit more, add another 10 to 30 path tests, 10 to 20 path tests. Then what we normally do is say a couple of weeks later, let's book another hour in, and invariably either that meeting or the meeting after is cancelled, because you don't need any more help. We sort of got your head around it and you're up and running. We have a fully supported help desk, obviously, where we will get back to you straight away with any queries and support. There's training manuals, but it's not overly complicated. It's as I showed you on that drop down menu. It's just click buttons and drop down menus. And then we have our regular webinars for our existing clients, where they share sort of tricks and tips and things like that. Good. Okay. I can hear Sanj typing away busily in the background. So let's stop sharing my screen. Hopefully that's worked, and we can get to the questions. So if we go through them one at a time, and either Sanj or I will answer them. Whoever can be whoever give you the best answer. So first question, keywords can be pulled from the problem page, not just from path clinical information ? Sanj?
Yeah, so both essentially. So you can probe the problem page in absence of a condition, i.e. diabetes or hypoglycemia, and again that keyword check can also apply to the pathology test result as well, the textual piece within the result.
Okay, thank you. Can it differentiate between diabetes and diabetes in remission and pre-diabetes? Sanj, another one for you.
Again, yeah, so yes, as long as it's labeled like that within the problem page. So again, it's all down to how you define those keywords. So you could put in, again, we've got clients doing this where they're looking for in absence of diabetes or in absence of pre-diabetes. So yes, you would just spell the word in that keyword box, and it would apply those checks.
Thank you. Next question, do you have any helpful advice to as a reasonable percentage tolerance on changes for each results? Okay, so that's something we can't advise you, but we can connect you and share information with some of your colleagues across in primary care, qualified clinicians, obviously, where you can have those conversations with them. We're more than happy to share any information that we've been given to share in terms to support that. So the short answer is we don't advise, we can't advise, but we can introduce you to people who are using the tool, and hopefully they'll be everyone seems to be very helpful to each other. I'm sure that you'd be more than happy, and you'd be welcome to join as a client any of our training webinar groups where they talk about stuff like this. Can you link it to the medication screen so we can use it to monitor levels on initiation of statins, for example? So, Sanj, do you want to take that, or shall I?
Yeah, just to add, it doesn't. We look at the problem page, not the medication screen. And just to say, this is something that we're sort of looking at through the abnormal product, which is due to be launched sort of next year. But yeah.
Okay, so I guess the short answer to that is at the moment, no, but another important thing for MyBotGP is if everyone on this call presumably has a mobile phone, they've either got an Android or Apple or for some maybe others. So every now and again it says turn me off and on because I've got an update, because I've got more functionality. Same as Windows, same as other computers. Our product can do that as well. That's massively important in primary care. It means we can have 1,000 practices using 1 or 2 or 3 of our products, and we're constantly working on enhancements. So we are building out changes all the time. Not saying we're going to change it every week. Obviously, these things take time and they're important, but there are periodic updates, and one day you'll flash red and say turn me off, turn me on, I can now do this, and it will have additional functionality. So Sanj is quite humble in his description. We're looking at stuff like that at the moment, but as of today, no. Did you say SystmOne send SMS through SystmOne or via AccuX through SystmOne? How do you differentiate shared care so meds can be reauthorized? Sanj, it's not. I don't believe that's under under the remit for this tool. Yeah, okay, I got this one. So, yeah, I mean, to be safe, this tool is a normal pathology filing filtering tool. That's what it does. So it's there to knock the legs out of the Yeah, it is there to knock the legs out of the normal pathology filing, and free people to be able to spend more time on this type of stuff rather than filtering. How many different filters can you put on the same pathology result, i.e. HbA1c? Can it check for? I think we've answered this question already. Is that right? Have we, Sanj?
Yeah, so for HbA1c, pretty much all of the above as mentioned. So you can apply keyword checks in terms of pre-diabetes. You can apply specific age and gender ranges as well. So all of the above, really.
Thank you. Is the SMS message a standard message, or can it be changed depending results?
I can take that. Yeah. So again, it's freely defined. You would tailor the message within MyBotGP, and yeah, it's fully tailorable as to how you want to send it and what you want to send.
Okay, interesting one here. We know there is an issue with the filing of pathology onto records in SystmOne and how it needs to be seen in the NHS app. What happens is where one test may be abnormal in a test profile, such as LFT, and the rest are normal, yet on the app all are abnormal. Does this system help us to sign individual tests to get around this problem?
Yes, it does. Within SystmOne, it marks the battery as reviewed. So what that means is it's signing off individual test categories, and on the basis where you have a multiple test, as in you're testing for multiple pathology test categories, if one of them is abnormal, it skips that one and obviously processes the ones which are normal.
Thank you. I have one clinician who wants to see all of their results, even the normal ones. Can you exclude individual requesters' results, or is there the ability to notify a clinician that a patient's results have all been filed as normal? That's an interesting one. We come across this sometimes. It's happening, and it's happening less, but that's not to dismiss how important it is. And Sanj will correct me if I'm wrong. The advice we were given that we followed to support this from our safety officer is nothing is removed from where the path tests are picked up. They are marked that they've been ordered, that they've been validated through MyBotGP, but they're still there. And that's what I was referring to at the beginning, earlier on in the call, saying how you archive or what you do with the path tests at practice level is up to you. So in principle, you wouldn't be able to just push it against one individual person unless you reconfigured some stuff in your system. But what I'm saying is you can leave them all there. And then for that particular clinician, they would go in as normal and they can still physically audit the path test to make sure that they feel comfortable with the result. Sanj, you look like you have something to add on that.
Yeah, just to say, it does filter on the kind of general inbox, the global inbox. And what in terms of the latter part of that question is, can you notify clinician that a patient results have all been filed? So what we have as part of the audit is at 5 p.m. it sends a daily status report, and it gives you full accountability of its day's action, as in at pathology test category, what it's done, what it's filed, what it's skipped. A very detailed, comprehensive report. That one will check every day just to make sure that it's in line with what you wanted to do.
That's a good point. So what you're saying is that clinician could be added to that status report.
Correct.
If you wanted to.
They would get
fine.
Yeah.
Okay. So that status, I believe you can add multiple people to that status report. Yeah.
Unlimited.
Okay, so they get an email every day, and if you wanted to explore it further, you go into the app. Okay. With our lab, EMIS, we get TFT, UEL together results in one lump. If just one result is abnormal, will the rest not be filed even if normal? Sanj?
Yeah, so the way you'd set that up in the platform is it would be set up as two separate pathology test categories, and it will be able to understand and decipher, spit out which ones are which, and it would apply your ranges. No different than the normal. It's the same, even if it does lump them together. We've seen that as well. It can split it out and be able to apply the ranges that you've popped into the platform.
Okay.
Just to add, if one of them was abnormal, it wouldn't file it, and it would only file if normal.
Okay, thank you. At our practice, we send all results, even if normal, back to requesting clinician to review to inform management. with this tech, it means that clinicians won't know that results are back for review. Okay, so I think we've covered answering that question on previous questions that were asked before this one was written. The short answer is you can still see a copy of everything. Does that sound a better way to describe that?
Yeah, I think I'm not sure. Yeah, 100%. And just to add, you can apply a different commentary if that's where that's going. You know, where you file with comments, so you are able to tailor those comments when it does the actual filing within the platform. So at the bottom left-hand corner, you can do file no comments or file with commentary, and you can actually put a tailored comment in there if that assists as well.
Okay, so essentially you can still physically see all of the pathology test results. Nothing is whizzing through and being filed without you having sight of it if you don't want to. If you want to, is the short answer. Does it update the request as complete on SystmOne?
So what it does, it marks battery as reviewed. It clicks on that button, and then again, you can have the ability to archive it as well within the platform. You just set a quick tick box so it can do the archiving as well.
The next question is a very prevalent one. How close are ICBs to hosting this on their secure managed network infrastructure? Is this still a way off? Seems there is some pushback regarding hosting this locally. That's $1 million question. There is, unfortunately, in primary care, there is not a standardized approach for everyone, and all of them have their own version of what they want to do or what they don't want to do, and that's the reality of it. So for some will say yes, some will say no. Others are happy to have it hosted at practice level, others aren't. However, what we're doing to support this, we can't release who this is with yet, but I'm happy to share that we will be having a hosted offering, fully hosted offering. Well, it's already available shortly, but it's available now, but we can announce it more formally later, where it's in a secure NHS environment, DTAC, DPAA, all locked down, so you can have a hosted offering, and that will supersede the necessity to ask if there's spare capacity to help you out at the ICB. You can just acquire this yourself in a unique, safe way, because essentially what that question is saying is you're asking, is there any spare room to host this for me, and how much how much you're going to charge me at the ICB? So we found a way to circumvent that, which is great. So each to their own is the short answer. How does your RPA cope with pop-up systems failures, crashing, buffering delays? That's we cracked that nut some time back. Pop-ups are challenging because they come at random times and they can have different messages, and you need to be in control of what the answer to the pop-up is. We actually built some capability in MyBotGP that we've taught it to ignore certain pop-ups that you're comfortable with us ignoring. Obviously, that's validated by you. And every time it sees a new pop-up, because it's going to see a pop-up, it's going to ask you what to do with it. And it will say, hi, I've seen this. What do you want me to do with it? If you say, file that, save it, ignore it, and what do you want me to do next time I see it? Ignore it. It won't ask you again. So you actually teach it as you go along. And then any pop-ups that you do want to have sight of, if that is the situation, they'll be there for you to look at. It won't touch them. Failure, crashes, buffering, delays. Yeah, it happens. 100%. That's why we built this. This is a bespoke built product for TPP and EMIS. It's very robust, and it's an important differentiator as well. It's why we can patch update. This is not a tool where we've bought robots from, I don't know, the left hand, and then we're teaching them how to interact with you on the right hand and asking you what to copy and how to do it. They tend to be a lot less robust. This has been built. This is a product built, so it will wait, it will retry. If the page is stuck for a bit, we built in delays, so it'll wait for the page to refresh. If it needs to come out, or log back out, log back in, all that type of stuff to keep it super robust.
Yeah, I mean, I just to add on that, conventional RPA doesn't work. Our tool is far more sophisticated in terms of what it does. Again, we've been down this path with conventional RPA. It crashes, it burns, it's not intuitive, it doesn't learn. So our systems with complex algorithms which pick up pop-ups, prompts the user, What's the action? It stores that action in its brain. It never asks you again. Crashes and buffering, etc. Again, it learns the pace of the network. It learns how SystmOne is running on your network. It then basically sets its own speed and things like that. So again, it's not your sort of out of the box RPA from know the kind of names in the industry.
Yeah, so yeah, and something we're very proud of, and that's why we anything MyBotGP. So our business is JivJaff, but the product line is MyBotGP. Obviously, what we've done by separating that off is to confirm that they are purpose-built products, as Sanj just covered off, specifically built for this task, fully under your control, quick to install. Can you see in EMIS the record that was filed by MyBotGP? Yes. Sorry, joined late.
You just missed a couple of questions.
Right. Okay. Oh, okay. Do you have any?
Yeah.
Got you. Apologies. So it's very difficult to give an exact number because on exact time savings, which is why we use the figures that we do. Different practices have different patient demographics, and they've got different sizes, different numbers of clinicians, different patient list sizes, which mean that everyone's receiving different volumes, different types of tests at different levels. So an exact average is not yet has not yet been confirmed. We're hoping that with this type of tooling in the next sort of few years, we'll be able to share those metrics, because it's this type of tooling. No one's ever been able to have a full audit log before in the way that you can now with MyBotGP. However, the stats that we've been working on, that we got from various NHS and NHS sources and meetings that we've had with people, is it's about, believe it or not, it's up to 19 days per clinician. For every clinician in the country, up to 19 days time is spent. And coming back to the analogy before, 3 coffees a day, 15 minutes a day, that's 91 hours a year based on a 8 or 9 hour day. So you can see how quickly these numbers add up. So 19 days. Roughly how many hours is it? We're running out of time, so we'll whiz through these. We've got about 5 minutes left. We can go on a bit longer if people have any more questions. But very roughly, how many hours does it take practices to set up? We're really proud of that. It's a quick download, plugs into EMIS or SystmOne. Don't need any clinical time. As long as there's no hitches, it doesn't take too long, half an hour, 45 minutes, 10 minutes to get it plugged in. Then it runs for a couple of days. And then we need to meet. Then you need to meet a clinician and the team, and whoever's going to start to make decisions and on which path tests to include or not include, and what rules to add. First meeting, normally about an hour and a half. 20 to 40 path tests included, roughly 30 to 50. It depends how much experience or the appetite to get them on. A week later, another meeting for about an hour and a half. And then, as I sort of touched on earlier in the call, and then that normally gets people up to 50, 60, 70. Third meeting, we're more than happy to have a third meeting again a week or 2 weeks later to see whether we can get more in. But invariably, most of our clients don't come back for a third or fourth meeting. They've sort of got the gist on their own, and they're happily working on their own, adding them in. And it doesn't take long. It's a couple of seconds or a minute once you've decided on the logic per path test, just to double click on it, open it up, adjust the range, and so on and so forth. So it's quick. You do need a bit of time to get it. Obviously, it's not saying it's not going to take any time. Of course, the more pathology tests you are happy to include, and you include, the more time you'll save. If you acquire this tool and do 10 pathology tests and leave it at that, you're going to say it hasn't saved me much time. And some people need a little nudge to say, come on, put another hour in here or another hour in a couple of weeks, and then they're up to sort of 50, 60, 70, 80, 90, and then the appetite to get more in is there, because they can see the time saving, because once it's done, it's done. I think I answered that already. Yes is the answer to that. Can you see this in the EMIS record? And then the final one, unless any more questions pop in. Sorry, I'm unsure, joined a bit late. Is there a way of checking insulin glycoside for HbA1cs if normal, HbA1c do not want to file if taking. Sanj?
Yeah, as long as that's listed in the problem page or in the history, then yes, you can do a keyword or an absence of a keyword and pop those keywords in. If they're in the actual medication piece, then no, it doesn't look at the medication, but it can look in. It does look in the actual problem page and the history of the patient, so you can apply those keywords.
Okay, if we have any more questions, please pop them in the chat. What we will do is we've recorded this. We will tidy it up a little bit, put it onto our website, and share that with everyone that's attended and people that have registered as well and haven't managed to attend. We also have a page that we're going to put up for people that have attended the webinar, where you are able to acquire the tool through that page, and there is a slight discounted price in that. Obviously, in addition to that, if you have any questions or want to explore any further, please let me know. And yeah, I'm sure you've had our email details by now. I believe Deandra has emailed everyone with confirmations. My email was in the on the invite. I'll put it again here, so everyone has a copy of that as well. Yeah, we're going to hold monthly webinars now, running through all of our products. We've got, I believe the next one will either be document or repeat prescriptions for EMIS. And shortly we will be going live with some additional TPP products as well. Anyone that's been on this webinar, we've added you to our newsletter. I think it's once a month or every 6 weeks, and it will have sort of updates and stuff. So yeah, brilliant. Thank you, Sanj, for support. Cool. And I look forward to hearing from you. Bye-bye. Bye.
Bye-bye. Thank you.
Bye. Thank you. Bye-bye.